From my perspective, this is an exciting new chapter in the history of heart research here at the National Heart, Lung, and Blood Institute. And we're so pleased that we can be combining forces with Suburban Hospital. Not only will it bring cutting-edge research combined with a full-fledged, top-quality clinical service program to the citizens of Montgomery County and the greater DC area, but the results of the research being conducted are clearly going to benefit individuals across the country. We really see this as a model for a public-private partnership in heart research. We believe that the research programs that Dr. Horvath will be developing will really serve as models nationwide for the types of research that heart surgeons will be engaging in over the next decade. We all have tremendous pride in this program.
I'm a cardiac bypass surgery success story, another success story from the NIH Heart Center at Suburban Hospital. I feel very blessed, very fortunate that Suburban Hospital was 10 minutes from my office, 2 blocks from my house, and that the NIH Heart Center at Suburban Hospital was available to do my surgery. It's a very interesting phenomena that, you know, the very large sign was on Suburban Hospital for some time about the NIH Heart Center, but it's not really in your frame of reference or in your mind until something happens that changes it from being in your peripheral vision to being the only thing at the center of your vision. And in a short instant, it became the most important thing for me. And literally the feelings, you know, after the operation and getting out were a sense of a new lease on life. For me, I think it was mainly the sense that I got from my discussions with Dr. Horvath that conveyed a sense of confidence and a calmness that I was very moved sitting with him, who, aside from his skill sets and experience, was the guy who literally had my heart in his hands the day before.
Some have said that geography is destiny, and the fact that Suburban Hospital is across the street from the NIH and vice versa should not be lost on anyone. And that is a critical part of this collaboration. It allows not only physicians and researchers to go back and forth with ease, but it also allows patients to do the same. You take an institution such as Suburban Hospital that has a very good and long-standing reputation with quality patient care, and you're combining it or teaming it with the research capabilities of the National Institute of Health. It's the focus of research, particularly medical research, is to become more translational, meaning that the data that are collected in the laboratory at the laboratory bench are translated quickly to the bedside. And that's the foundation upon which the NIH itself was built. And now it's expanding and involving an excellent hospital such as Suburban Hospital in that effort. There are basically no other opportunities like this in the country, and probably not anywhere else in the world.
I came here in May because I was looking for a challenge, and this hospital came with incredible recommendations from other people in the field. So, and I was really excited once I found out about the affiliation with NIH. So I drive actually an hour and a half to get here in the mornings. So. It wasn't an easy decision to make, but once I got to know everyone here, it was just seemed natural. I work in the CV ICU, so basically what I do is I recover the patient directly out of the OR. I love to recover someone after open heart surgery. Being the first person that they see and sitting there when you know someone's scared and they have a tube in their throat, they can't speak, and you hold their hand and you can just say, everything is okay. I'm just waking you up and you did fine. And it's so rewarding. It's the high blood pressures, the low blood pressures, the fluctuations and things like that that get me excited, because with these patients, we can fix it. You know, it's expected, we know it's gonna happen. Within a couple of hours, you see progress and they're waking up, and then they're scared. And you come in the next day and they're sitting in their chair eating breakfast.
The nurses here at Suburban Hospital are specially trained to take care of open heart patients, and they were fantastic at their job. I felt so very well taken care of, very professional people, and to give you a genuine feeling that they care about you as a person, not just the next patient. Actually, it is quite a shock to find out that this once healthy person is kind of going along in their life, doing their thing, and then whammo, you get hit with something that's just beyond your comprehension. And it does kind of put your life into perspective. You appreciate the people and the family that you have in your life, and you try not to take them for granted.
I'm the scientific director for the NHLBI, and therefore I'm responsible for the research program here on the Bethesda campus for NHLBI. So having our PhDs, our engineers, our physiologists, our molecular biologists actually getting a sense for what goes on in a hospital on the scale of Suburban, it really sets a new agenda for our research. A lot of the early cardiac MRI work was done here by physicists and engineers over the period of time. We made the analysis that the place where MRI could have its biggest impact on a cardiac patient was as they enter the healthcare system, right at the entry, to make a decision, yes, no, they need immediate care, they need to be revascularized, or no, this person really doesn't need acute care, may need something later or to be looked at later, but doesn't need that acute attention. Just imagine sitting in the room, which has happened in my family, where someone's come in with chest pains and to be able to go in and get an MR scan, and then to say, no, this is not something we have to worry about acutely. It doesn't, apparently you're not having a heart attack. That's a tremendous relief. The room we're in right now is actually the room where we're developing what we hope will be the next generation of surgical suites, and that is being guided by MRI to do the procedure, where you can do minimally invasive procedures and actually use MRI as your eyes, the surgeon's eyes, to see inside the body while he's making the appropriate repairs, or she's making the appropriate repairs. And I think we're very, very fortunate to have surgeons working hand in hand with our engineers and our scientific staff here and putting that future together.
One of the facets of the care delivered at the NIH Heart Center at Suburban Hospital that truly sets it apart from other programs is the direct interaction that our patients have with members of our nursing staff, all of our clinical staff, and our cardiac surgical staff. There is an atmosphere of caring and of unity that is unparalleled. The affiliation with Johns Hopkins University School of Medicine and the Division of Cardiothoracic Surgery brings to this relationship and brings to the NIH Heart Center at Suburban Hospital a wealth of clinical experience, as well as a top-flight reputation with regard to the conducting of clinical as well as basic science research in cardiovascular diseases.
My vision for the program is a broad one. It's first to provide quality cardiac surgical care for patients in the surrounding areas who are taken care of by cardiologists at both the Suburban Hospital as well as NHLBI. But it's bigger than that, in that I view Suburban's cardiac surgical program an academically based program that will allow the translation of the basic research that's done at the NHLBI to those patients who are at Suburban Hospital. And that research will also be translated into patients being operated at Johns Hopkins.
So our first challenge is to develop this as a premier cardiac surgery and coronary intervention program. We have to establish the safest and the most effective clinical means to take care of our patients. But as we go forward from that, our next step is to really join with our partners across the street at the NIH, the scientists, and the clinical scientists that are working there in order to formulate important questions that we can then use the facilities, the clinical facilities here, the basic research facilities at the NIH to solve important problems that lie ahead for our population worldwide. I've been working in cath labs in the area for 30 years, and over that period of time have been able to identify very outstanding people who can bring compassion, care, and clinical expertise to this facility. And fortunately, we've been successful in recruiting many of those. So we have an extraordinarily experienced staff here.
Now, with the cardiac surgery available here at Suburban Hospital, we can perform the coronary interventions, which usually are successful well over 90% of the time. Behind me is some of the most modern digital cath lab technology. But what we also focus on here at Suburban is the fact that the patient that we're working on is a human being who's someone's mother, who's someone's father, daughter, or husband, or wife. And we focus our attention on the individual other than the images in the coronaries that we're trying to fix.
For the patients, it's incredibly overwhelming for the majority of them. This is their first experience into this realm of cardiac catheterization. So the fear of the unknown is so overwhelming that they don't know which way to turn, and they look to us a great deal of time for reassurance. The sense of gratification I get from working here at Suburban Hospital is the knowledge that I have when I see the difference I've made in a patient's life.
My name is Janice Linderman. I live in Alexandria, Virginia, and I had 3 stents put in August because I had a heart attack, and they brought me to Suburban. And there's no doubt in my mind that I would not be alive if I hadn't been this close to Suburban when I had the attack. I remember the ambulance getting there. I remember saying, please make the pain stop. Then I said, I'm going underwater. When I did wake up in ICU, the care was just outstanding. There was always a nurse. It seemed like there was a nurse in my room every other minute taking care of me. And I also am a widow, and my only son is a college-age young man. And when he arrived at the hospital, the nurses told me later that they knew that I was a widow and that I had no other family here besides Patrick, and they had decided that one nurse would be assigned to Patrick. And they were very, very kind to my son. The doctor, even though he's a 20-year-old college kid, he was still an only child that had seen one parent leave in an ambulance and not return. So, but the doctors spoke to him in a way that he could understand it.
You look wonderful. I'm the healthiest person that ever had a heart attack.
Even though I live in Alexandria, I am going to continue to come over to Suburban Hospital to see the cardiologist that saved my life. Suburban Hospital certainly got me prepared to hopefully have a very healthy heart the rest of my life.